My goal with the Caring Corner is to include current information about treatments and therapies that might be helpful as you care for your loved one. And today I want to talk about something called Lecanemab. And the broad community of people who are involved with Alzheimer's disease is generally in an uproar because the Centers for Medicare and Medicaid Services have elected not to include this drug among the drugs that Medicare will pay for. So if you want it, your only option is to obtain it via private pay at a cost of $26,500 a year. And of course, that's pretty expensive for most people. Is this decision of Centers for Medicare and Medicaid Services good or bad? Why did they make this decision? And what does it mean for you or a loved one if you have Alzheimer's? To begin with, Lecanemab, also known as Lecanemab, reduces the development of harmful beta-amyloid plaques in the brains of people with mild Alzheimer's. It's administered through an IV every 2 weeks, and it'll last up to an hour for each infusion. The drug is remarkable because it's the first treatment that has been shown to offer some slowing of cognitive decline in people with early Alzheimer's disease. And if you can slow the procession of Alzheimer's, you'll have more time to enjoy your daily life, your family, your loved ones, and live independently. The Alzheimer's Association reports that Lecanemab can get you 5 months of delay in the progression of the disease. Again, the reports emphasize that that's if you take it in the early stages. And it emphasizes, too, that it does not cure Alzheimer's. It simply seems to slow it down. So that's good news. But why did the CMS deny coverage for Medicare? And the reason is because Lecanemab was authorized using what's known as the Food and Drug Administration's accelerated approval pathway. Accelerated approval is something the FDA reserves for therapies for serious diseases that have few or no treatments available, which is the case with Alzheimer's. And because it's an accelerated process, this type of approval does not require all the data from phase 3 clinical trials as full approval does. So the FDA granted approval for Lecanemab based on reduced set of trial data. And the Centers for Medicare and Medicaid Services doesn't cover medications in Lecanemab's category that only have this limited accelerated approval. It will cover them if the FDA were to give it full approval, which of course will require a lot more study. The good news is that most experts believe that the manufacturer will submit an updated package to the FDA seeking full approval once that's ready. And then, of course, at that point, the Center for Medicaid and Medicare Services would provide broader coverage. So right now, it's not available broadly, and is that good or bad? Let me list a few reasons why it might make sense that it's restricted, but at least one reason why it's bad. It's good from the standpoint of safety. The whole point of the CMS not approving drugs with accelerated approval is because, frankly, they have much greater risk associated with them. Because with accelerated approval, there's more uncertainty about safety and the degree to which the drug will actually be effective. In the past, some drugs that were granted this type of accelerated approval later were proven ineffective or even unsafe for patients, sometimes after being on the market for years. And an example is Avastin, which was given the accelerated approval for breast cancer treatment in 2008, but later had it revoked by the FDA in 2011 because it was found to be ineffective. So Lecanemab has raised a bunch of safety concerns because of side effects, especially brain swelling and bleeding. And these concerns have become intensified in recent months because there have been at least 3 deaths of people who were participating in the study who passed away as a result of this same brain swelling and bleeding. Another reason is that many experts say that the patients really won't notice a difference. They say that Lecanemab's effects are just modest at best, and it's not clear that it will produce a noticeable change in people's daily lives. In the testing process, cognitive decline is measured using a subjective, self-reported scale that focuses on people's own opinion of how they're doing on things like memory, judgment, and problem solving. So the rating method is very subjective and it doesn't have a lot of hard data. On the other hand, though, that's exactly how a lot of dementia diagnoses work. Self-reporting is one of the few methods researchers have in their attempt to quantify symptoms in patients. So why is the CMS decision bad? Well, it's bad if you or a loved one have early stage Alzheimer's and you're concerned about the outcome. For many folks, Alzheimer's disease is terrifying, and anything that offers improvement is cause for hope. My opinion is that if the FDA felt Lecanemab should be approved, then Medicare should pay for it. All medications have risks and side effects, and we are all going to pass away anyway. They should make it available and allow each individual to consult with their doctor and decide for themselves if the risks are warranted. What are your thoughts? Should Medicare pay for Lecanemab or not? Please let me know in the comments section below. Thank you for watching The Caring Corner, where we cover everything related to Alzheimer's, dementia, and caring in general. If you believe your loved one might have Alzheimer's, see my video here about the 10 warning signs for the disease. Thank you for watching, and God bless you in your caregiving journey.